Welcome, everyone. All right, this is the introduction to Canary Corps. We're so excited to have you here today and for this first community event for Canary Corps. I'm Ben Seaborger, the U.S. Advocacy Director at ME Action. My co-facilitator today is Allison Sabrana, who I'll introduce a little later. Allison has been working closely with us to design the Canary Corps program, and I'm so excited for what she's going to share with you today. All right, next slide. So the purpose of today's event is going to be explained to you the 4 key areas of disability services and supports that will be the initial focus of the Canary Corps program. Today, I'm going to briefly cover why we are creating Canary Corps, what that program model is, and then I'm going to hand it over to Allison. She's going to share some of her personal story with disability services and supports, as well as the larger historical context for how and why they were established. Then Allison will walk you through each of the different disability services and supports to explain them in more detail and provide examples of how they can help our community. And finally, we'll wrap up with next steps and a Q&A. Next slide. All right. What we won't have time for, unfortunately, today is to get into a lot of the details around volunteering, how that will work, as well as the steps to participate in the Canary Corps program. We're still finalizing some of those details, and we won't be launching until early 2024. So for now, if you're interested, check out the FAQ on canarycorps.org and sign up to get program updates. First off, we call this program Canary Corps, and I want to be explicit upfront about why that is. Next slide, please. So that is, those of us living with ME and other infection-associated chronic illnesses, have been the proverbial canaries in the coal mine that have been sounding the alarm for years and decades even on a danger that has been repeatedly ignored. Now, following a mass disabling pandemic, millions more are sick with long COVID, and something has to be done. This crisis, I believe, demands a community response focused on helping each other to survive the rampant ableism and medical gaslighting that is a threat to our communities. And while each of us is put at risk by the societal neglect of infection-associated chronic illnesses, we need to be clear, the harms are unequally distributed. We must pay special attention to how other forms of social inequality and discrimination exacerbate the crisis for the most vulnerable. Next slide, please. So we believe that the community response that we need to generate is in the most general sense about building what disabled writer Johanna Hedva calls a politics of care. We do this by building communities of protection and enacting forms of support that take seriously our own vulnerability, fragility, and precarity in this crisis. That is the common purpose around which we're building this core of chronic illness canaries to come together in action. Okay, so that's a nice vision, but what actually is the Canary Corps program? Next slide. We know that the system isn't working for us and that all of us deserve better access to support. And so that's why Canary Corps is going to build a bridge to help you connect to existing resources. Canary Corps is a grassroots, peer-run program to bridge the gaps between people with ME, long COVID, and et cetera, and the established disability services and supports that are near you. Next slide. Now, I could go very deep into this. We don't have a lot of time for this today, but this is in terms of how the Canary Corps program will work. This is a glimpse of the stages of the model, what we are calling the peer navigation bridge. We know that disability support and service systems are complex and can be exclusionary, and this makes it particularly hard to navigate for people like us with infection-associated chronic illnesses. So what we want to do is to empower sick and disabled people in our community to be able to help other sick and disabled people find the help they need. We know we won't be able to meet every need, but we believe by creating a highly structured program that breaks down these navigation challenges into a series of smaller steps, we believe we can make a national peer assistance for our communities a reality. And the help we provide can grow and improve over time as it's informed by the lived experience of those that we work with in this program. Next slide, please. Okay, so what exactly are the disability services and supports that Canary Corps is going to help you connect to? Well, we've strategically selected these 4 areas. 1, affordable health insurance. 2, medical care coordination, 3, disability information, advocacy, and assistance, and 4, home and community-based services. Now, to help explain these disability services and supports, I want to introduce you to Allison Sabrana. Next slide. So Allison is a disability activist living in Fort Collins, Colorado. She has ME, POTS, and related conditions after contracting a virus almost 10 years ago. I've loved working with Allison, and I can tell you she is passionate about helping chronically ill and disabled people understand their rights and navigate barriers accessing care and services available to support them. Allison's passion for this is personal. She struggled to access care and services to support her daily life as a disabled Coloradan. But it's also a core aspect of her professional work as a former community health manager for Colorado's Medicaid program. Allison, I'll turn it over to you now.
Thanks, Ben. Okay, getting myself set up here. Okay, I am so excited to be here today to talk to you about this program. If there's anything you take away from today's presentation, I want you to understand just how much getting disability services and supports has changed my own life living with ME in a good way. I helped advise on Canary Core because our community deserves to have the same access to service and supports that I've had. We all deserve to have our needs met. So like Ben said, I'll talk you through a little bit of history and context about these services and supports, and that Canary Core will bridge our community to, including some examples of how these services have helped people with ME. So in 2016, my chronic illnesses worsened significantly due to lack of access to informed care and lack of access to support services. And that had a daily impact on my general survival, but also my finances. I had to go against medical advice to stop, rest, and pace, and I pushed myself to continue working until my body literally could not continue another day. It took me many years, I estimate about 8.5 years, to get access to all the supports and services I have now that made any chance of financial stability and medical stability possible. Even today, my ability to manage my medical condition, ME, POTS, and related diseases is deeply intertwined with my financial survival. And I know I'm not alone in that. In 2022, last year, I spent $13,000 and $13,421.40, an amount equal to an entire year's worth of income at 100% federal poverty level on medical expenses alone. So that used up all of my SSDI payments for the entire year just on medical expenses. And during that time, I was dually covered by Medicare and Medicaid. So this was all expenses outside of insurance when I had all of my premiums, copays, and deductibles paid for. This is the lowest that my expenses could have been. So depending on the day, I may or may not look disabled to some people, but I know that my fluctuating dynamic disability, which people with ME and related conditions often experience, is still a disability, and I absolutely deserve disability services and supports just like everyone in our community. I share this because this is not a unique experience. We know it's so common across our community, but it's something that I struggled with even though I worked professionally in the system. I didn't access services and supports that I needed for too long because I didn't think I would qualify because of my dynamic disability. I also want to point out that I acknowledge that chronic illness and disability exacerbate and intersect with existing social inequities and other forms of discrimination that I haven't experienced. Okay, so I want to talk a little bit about my background, having worked as a community health care manager here in Colorado for a Medicaid program. Backing up just one step, Medicaid is a federal and state health insurance program. It's operated by individual states, and it provides coverage to millions of Americans. It's also the primary payer across the nation for long-term care services. And Medicaid covers children, adults, seniors, and people with disabilities. So I was working for this program here in Colorado. And as my disability progressed, as my ME got worse, because I kept pushing myself to continue working. It was literally my job to help people apply for programs and access appropriate care. And yet I struggled with that after I was done working to meet my own needs, even though it was my job to do that for other people. After I couldn't continue working as a care manager, I even worked in the office in my county that processed Medicaid waivers, and my employer saw up close my decline with ME, that I couldn't even sustain part-time work in a power-assisted wheelchair, and they still didn't think that I would qualify for home and community-based services because they were fundamentally misinformed about how dynamic disability presents. So all that being said, this is hard stuff, but I really do want to communicate that in all my years of living with these infection-triggered chronic illnesses, there is one thing that has made the biggest difference in my quality of life so far. That one thing is disability supports and services that I receive. That's why I'm so passionate about making sure that our community can access them. Accessing these services make it possible for me to use my limited energy living with ME to build a fulfilling life out of a new normal, living with chronic illness and disability and participating in my community, even with my limitations. This is what informed my work on Canary Corps, and like I said, why it's so important to me that our community be able to access these services. So like I said, many of us know how hard it is to get access to the support and services we need. It's not for lack of trying, that's for sure. So we face a lot of systemic barriers when we try to get our needs met. This looks like complicated eligibility criteria. It looks like long and complicated application forms or recertification forms in order to keep staying on your benefits once you access them. It looks like inaccessible information about the assistance programs or about the offices where we might be able to apply for them. It's lengthy wait times for appointments or for evaluations that are required in order to get access to programs. And it's also stigma or attitude of the workers who process applications or the professionals who need to sign off on them. For example, like when a doctor won't sign off on a handicap placard application or anything similar to that. The other thing that makes it hard, combining with those systemic barriers, is the nature of our disease. It makes it almost impossible to get the support that we need. It would be hard for a non-disabled person to navigate these systems because of how complex they are, but it's especially hard for people with energy-limiting chronic illnesses like ours. We often don't have the energy to get through the bare necessities of our day, let alone navigate complex paperwork, systems, and assistance programs. The nature of our disability makes jumping through all of these hoops seem just as doable as climbing Mount Everest for us, pretty much impossible. So now that we've talked about briefly how much disability support services have helped me and improved my quality of life living with ME, and acknowledge just how hard they are to access, I want to step back for a moment to talk about where they come from. How did they get established? And what's the history there? So first, I want to note we could dedicate an entire webinar series to the history of disability advocacy. That's not what we're doing today. I'm just giving you a tip of the iceberg preview so that you understand the historical context of these services that we're talking about. So there was a lot of work happening at the same time that all of this work that was going on that I'm going to talk about today, but we're specifically focusing on the cross-disability efforts here that are most relevant to our community of people with infection-associated chronic illnesses. Okay, so back to the slide. I want you, our community to know that chronically ill and disabled people who came before us fought for their right and our right to access supports and services. In fact, we may have more in common with these people than you might think, because many of them were also disabled by infections. For example, Judy Heumann, who is pictured on the left here holding the sign 504 Regs Now sign, was disabled by a virus, polio. She and other disability activists fought for Section 504, which was the first civil rights protections for people with disabilities. If you have seen the film Crip Camp on Netflix, you may be familiar with some of these stories. At the same time, in the 70s, Ed Roberts started the first Center of Independent Living in Berkeley, California. The National Independent Living movement started with this, and it really shifted the framework of disability away from the medical model. The independent living movement instead pushed for peer support, advocacy, and information, and these are all common themes today among our chronic illness communities. I promise this is relevant to what we're talking about today with Canary Corps. One of the programs that was life-changing for me as a person with ME was home and community-based services with Medicaid. It allows me to pay my husband and a caregiver I hired using Medicaid dollars to support my daily life at home living with ME. We'll talk more about that program in a later slide, but here's a little glimpse into how this service came to be. A whole collection of advocacy and policy change led to home and community-based services with Medicaid to make it possible for chronically ill and people with disabilities to receive care at home today instead of an institution. This started in the 80s and advocacy continues today. The Developmental Disabilities Assistance and Bill of Rights Act was part of that work, and so was the 1999 Olmstead Supreme Court decision. I specifically wanted to highlight that Supreme Court decision, the Olmstead, because one of the plaintiffs in this historic case, pictured on the right there, has an infection-triggered disability. So this is our final slide on the historical context. Like I said, a super brief overview, just the tip of the iceberg. There was a lot going on at this time, but I specifically wanted to highlight these last few things today because they affect people with ME, long COVID, and infection-associated illnesses today. So in 2008, we saw the broadening of the term disability in the Americans with Disabilities Act, ADA. And for our community, this helps ensure people like us who may have fluctuating dynamic disabilities, it helps ensure that we can be protected from discrimination under the ADA by fitting that broader definition of disability. And in 2010, the Affordable Care Act, which had a variety of benefits for people with ME and related conditions, like prohibiting discrimination based on pre-existing conditions so people like us could actually access health insurance coverage. It created the essential health benefits, and that set a standard for comprehensive care that needed to be offered from insurers. And finally, the money follows the person. That pushed states to shift from institutional care towards community-based care, just like what I received today from Medicaid in being able to pay my husband and a caregiver for services in my home. So now, the moment you've probably been waiting for, as we've talked about the history, how does that history affect people living with long COVID, ME, and other chronic illnesses today? The disabled and chronically ill people who fought for our rights and fought for various services may have had different diagnoses than us, but we have a lot in common. They were not just fighting for themselves, they were fighting for everyone now and into the future. Today, living with chronic illness and disability has a huge impact on our daily life. It can be so difficult to make ends meet financially. Households with a chronically ill or disabled family member need an extra 28% of income for the same standard of living as non-disabled households. I'm going to say that again. They need an extra 28% of income to have the same standard of living as non-disabled households. This is a recent statistic per the National Disability Institute. Beyond just making ends meet financially, it can also be hard to just keep up with the daily tasks of life. These are tasks like preparing meals, doing laundry, bathing, getting dressed, going to the doctor, going to the grocery store, picking up prescriptions, things that people with chronic illnesses often have difficulty with on a regular basis. So, bringing it all together, we know how living with disabling chronic illness impacts our daily life. We know how hard it is to get help or support for it. And now we know a little bit about the history of what previous disability advocates have fought for. The services they've fought for can help us today by making it possible to meet our daily needs and giving us a chance at making ends meet financially. But we know how hard it is to access these services, and this is exactly where the Canary Core program comes in. It's designed to help connect our community with these kinds of supports and services. So now we'll talk about the specific services and supports, and I will explain some examples. Like Ben said earlier, we have these 4 different areas: affordable health insurance, medical care coordination, disability rights and discrimination, and home and community-based services. The first one that we'll talk about is affordable health insurance. Health insurance can be so complicated. It's complicated for people who don't have any chronic diseases or chronic illnesses, which means for people like us, it's that much more complicated. Chronically ill people may unintentionally miss out on affordable health insurance options because the system is so complicated, and we do not want that to happen to you. This is where Canary Core comes in to help bridge that gap and get you access to locally informed health insurance help. That comes in the form of local enrollment assistance sites. They're completely free. They can help you understand all of the options available to you for affordable health insurance, even going so far as plugging in your prescriptions into the computer to calculate cost estimates and figure out the right plan for you, and helping you actually apply and access that affordable coverage and continue to have that affordable coverage. A real life example of a person with ME accessing this kind of support. So this person with ME was about to lose their health insurance coverage because they could not continue working as their symptoms worsened. They were referred to their local health insurance enrollment site for free and learned about a disability health insurance program offered through the state. The local enrollment assistance site helped them fill out the application, and several months later, they got approved. From that point forward, they had no more bills from the ER or the hospital. All of their drugs were covered in full. The copays for doctors and therapies went down to $2 with no deductible, and they could finally focus their limited funds on other basic needs like paying rent, groceries, and medical costs not covered by insurance. This program was life-changing for them, and we want to make sure that you are not missing out on a program like this. But each state varies so much in what they have to offer, which is why Canary Core will connect you to a local office in your region to advise you on the options in your state. So the second area, medical care coordination. We all know it can be nearly impossible to keep up with coordinating all the moving pieces of our medical care, especially when energy limitations are involved. When this happens, it impacts our care and ability to manage our symptoms and diseases. The possibly good news is this is a common problem in the healthcare system, and that actually means there is some help available for it. That comes in the form of medical care coordination. They can help manage the administrative burden of medical needs by coordinating things like transportation, prescription pickup or delivery, communication between multiple providers at different offices or in different systems, helping you fill out applications for assistance, accessing community resources, and quite a bit more depending on the type of care coordination and where it comes from. Speaking of which, where can you find this kind of help? You can find it at a variety of different places. You can sometimes find it at medical provider offices if they have the staffing capacity. You can often find it directly from your health insurance company, and then you can also find it in community organizations. Oh, whoops, I'm going to go back to that slide. So one last note on this. Care coordination support is often available, but providers forget to refer us to them, or they don't know where to refer us to. They often forget that care coordination is available through insurance companies. They don't have enough time with us during appointments. So this is why Canary Corps prioritized it as one of our 4 areas. We want to make sure that you get across this bridge to access the care coordination that you need, and that's what Canary Corps will help you do from whichever location makes sense for you, medical provider, through your health insurance, or community organizations. So now to the 3rd category. We were talking about centers for independent living. So many of us know that adapting and embracing a new normal with chronic illness or disability can be so challenging. I myself have definitely experienced that. It can be a lengthy and difficult process, and there's a lot of logistical hurdles. So where do you go to get help with the various aspects of adapting to this new normal? This is where your local centers for independent living can come in. These offices offer peer support, skills training, advocacy, and referrals to local services to help you figure out how to live in your new normal. If you remember from the historical context part of our presentation, we talked about the independent living movement that was started in Berkeley, California with Ed Roberts. This is part of that, the Centers for Independent Living. So examples of this, if your ME chronic illness is making it hard to drive or you need accessible transportation, your local Center for Independent Living can help with that. If your illness or disability is making it difficult to keep up at work, they can help you understand your options, your right to request accommodations, or maybe counsel you on what options might exist for disability benefits. And then finally, and probably the most important thing that Centers for Independent Living do, is that if your illness or disability makes you at risk of going to a nursing facility, but you want to get care at home instead, they can help you understand your right to get care at home and how to access that kind of support in your area. Okay, let's talk about an example. So a person with ME was referred to their local CIL, Center for Independent Living, because their ME was worsening and they couldn't continue working anymore. One of the local Center for Independent Living staff helped them process through the emotional and just life consequences of needing to stop working due to worsening symptoms. They then explained the options for disability benefits, and over a series of appointments broken up to work with their ME symptoms, walked them through the entire SSDI application process, helping them fill out the paperwork and submitting it. This is an example of help that Centers for Independent Living can offer, but the offices do vary by region. So it's not that every single Center for Independent Living will be able to offer that. That's why Canary Corps is going to help you find your local office and figure out how they might be able to help you. Okay, the last section, which I very briefly touched on earlier, is home and community-based services through Medicaid. So our chronic illnesses and disabilities can impact our ability to keep up with daily life needs and tasks, like I mentioned earlier, especially with energy limiting chronic illnesses. And pacing can be such an important tool to help us manage our energy limitations. But how do you do that if basic life tasks like laundry and going to the grocery store exceed your energy limit on a regular basis? You have to meet those needs as well. The answer to this is home and community-based services. These services can provide you with support for those tasks so that you can prioritize using your energy the way that you choose. So what do these services actually do? And really quick, I just want to note that I've abbreviated home and community-based services up at the top, HCBS. That's a common acronym used when talking about this. And the term home aids also refers to this. So back to the services. They help with things like laundry, and that includes help doing the laundry, taking the dirty laundry down the stairs if that's necessary in your living space to start the laundry, start to finish doing the laundry, then folding the clean clothes and putting them away. Going to the grocery store, putting away groceries at home, then preparing the meals, and then washing the dishes after, start to finish. Picking up prescriptions, filling medication boxes, if that's something you want and need, it's not required. Like housekeeping, including making the bed and putting on clean sheets. I know I struggle so much with putting on sheets. It would wipe me out for like half a day. And then maintaining a humidifier or air filter, which can be really helpful for people who have mast cell activation syndrome or other environmental sensitivities. Providing non-medical transportations for outings you choose, like visiting a friend, going to the store, etc. Help with bathing, and that can also be in the form of paying for accessibility modifications for your bathroom to help you be more independent while bathing, if that's something you want. Help with dressing, including putting on and taking off compression garments, because that feels like a workout all on its own. Help with mobility aids. So this could look like pushing you in a wheelchair if that's what you want, lifting the wheelchair out of the car if it's heavy, helping you up curbs or through doorways if you prefer to push yourself, and then maintaining and plugging in equipment, which is important to maintain your mobility aid. And then one of the things that I enjoy the most, which is support being out in the community. So say you want to go to the farmer's market, but you're worried that like the temperature, the noise, or other factors might mean you might need to leave right away and you won't be well enough to get home on your own. You can have support with you to make that outing possible. And help filling medication boxes, which I noted earlier. Whoops. Oh yeah, that's what I meant to do. Okay. So let's talk about an example. So an example of a person with ME who accessed home and community-based services. So this person struggled with daily life tasks. They were overdoing it just to keep up with basic needs, something familiar to a lot of us in the community, I think. And they finally applied for home aids through Medicaid. It was really challenging to do it. There was a lot of stigma to work through, the dynamic disability thing, and just the application process was challenging. They were finally approved, and they got a budget from the state of almost $3,000 per month through a company that manages the funds and payroll to pay for caregivers, including their own family members, to help with laundry, meal prep, groceries, prescription pickup, bathing safely, putting on compression stockings, and so many other tasks. Now this person with ME is actually able to pace themselves because they aren't having to overexert just to keep up with daily needs. I think I mentioned this previously, but these services can go by a lot of different names, which can cause confusion in our community. So home and community-based services, long-term care Medicaid, Medicaid waiver, and home aids, all referring to this same program that we've been talking about. So, in case you haven't figured it out now, I was the example person with ME for all of these different areas.
Could you repeat that list again of the names it could be called?
Oh, yeah, sure. Let me back up. Home and community-based services at the top of the slide, which is also abbreviated HCBS. Long-term care Medicaid. Medicaid waiver services. That waiver term is really common because that's how they provide these services. And then Home aids is the term I see most commonly used in our community because it's on the How to Get On WordPress site. So, like I was saying, I was the example person with ME that I talked about through all of these different categories. And I wanted to use my example because I think so often when we ask for help or research the supports available to us, we don't see examples of ME or dynamic disability or invisible chronic illness. And so we think that we won't qualify or that we couldn't benefit from these services. And I will tell you, as a professional that worked in the system, I also fell into that trap. That's why it took me 8.5 years to actually get access to everything that I needed. The catch, though, is for me, the reason I got referred to all of these different places is because of my previous career, because I was working in the system. My coworkers, my former bosses, they were the ones that sent me to these offices, that called them ahead of time and said, hey, I have this person who needs this kind of help. Can you help them apply for SSDI? Can you help them apply for a Medicaid disability program? Can you help them XYZ? And I had that privilege because of my previous career. So now I want to make sure that our community can get referred to and access these same supports and services that I've been able to access by making a peer-run program. And that's exactly what Canary Corps is, to help bridge the gap between our community and these supports and services. So that also means that right now, Canary Corps is not currently able to help with several areas that are areas of need in our community. I want to talk about this really quick because these are complex areas of need. We are looking at what supports we can bridge you to in the future for these, but there isn't as clear-cut options as the 4 that we've already talked about. That's why we're still working on it and still researching. We are also working on collecting feedback for what the strongest area of needs are, and we definitely encourage you to submit your thoughts via the suggestion box that the link will be in the chat for. And I'm just going to read through these lists of specific things. Finding a specialist for ME or associated diseases. Our community knows that's a hard thing. There's not enough of them, so this is a huge challenge. Emergency care and crisis counseling, affordable housing, legal aid, disability benefits, and direct financial assistance. Canary Corps is not a mutual aid program. We will instead connect you with the appropriate assistance programs that will be able to help you. So I hope that hearing my story today has helped you understand a brief overview, tip of the iceberg of the disability supports and services that exist out there, how they can help people with ME, and that they are options for our communities, and that there is help coming in the form of Canary Corps to get you across that bridge to actually get your foot in the door and access these supports and services. So with that being said, Ben is going to talk through some of the logistical next steps, and then we'll get into our Q&A.
So what's next? Well, I hope many of you are moved by what Allison has shared to want to get involved to help us form this radical core of chronic illness canaries together. Remember, this is going to be a grassroots peer-run program, so we can only do this with your help. It'll be about sick and disabled people helping other sick and disabled people in a peer assistance model. So if you want to learn more about how you can make a difference volunteering with Canary Corps and get detailed information about how volunteering will work in a safe, structured, and sustainable way that works for people with disabilities, I want to encourage you to sign up for our volunteer info session that will be held on Tuesday, January 3rd at 4 p.m. And we'll drop the link in the chat. All right, let's move on to get to your questions, because I know we will have a lot of them that we want to get to. So next slide, please. Okay, please put your questions in the chat. Would be a great way so that we can read through them. If you want to ask your question verbally, that's fine too. The best way to raise your hand is going to be clicking the reactions tab at the bottom, and then clicking raise your hand. You'll see a little screenshot of that on the screen right now, how that works. And if you have, I know many of you may have additional feedback and ideas about where Canary Core could go from here, other things that we didn't get to cover. So we've created a suggestion box on our website. If you have feedback for us, please go to canarycore.org and leave any feedback or ideas in the suggestion box so that we can review. Allison, I think I see Doug's raised his hand. The first question, I know I've seen quite a few during your presentation, was about the how Medicaid programs vary by state, and what's the different, people asking about where they live and what Medicaid is available. So can you speak, and another question was frequently asked was about people who are working with disabilities. So if you can speak to those two things first, and then we'll cover some of the additional questions.
Yep. I'm glad this question got brought up. It's a really important one about Medicaid. So like I said, Medicaid is administered on the state level, which means every state does it a little differently. Their eligibility can look different. Their programs can look different. It also means that based on political history, that some states have more expanded Medicaid programs than others, which is of course inequitable access and not fair. But it is the reality that we're living in. And so again, that goes back to the way we have set up the Canary Core model, is that this peer-run program will help connect you with Medicaid information and assistance applying for it and navigating it and understanding it in your state to make sure that you are getting the most accurate information. That's important because for people with ME, sometimes the difference in us being able to access Medicaid and not is literally one paragraph of policy or not. And so you have to be able to access the kind of people that can help you understand that and get through the system. Speaking of which, I want to talk about the income limits for Medicaid and what happens when we're working, even if it's only a very small amount. So there are special Medicaid programs for people with disabilities who are working. They're often called buy-in programs or working buy-in programs, disabled working buy-in programs, disabled Medicaid. They go by a lot of different terms, but I'll give you an example here in the state of Colorado. You can have $11,000 of earned income per month. You can be working and make $11,000 of income per month and retain full Medicaid benefits, including waiver services. Now, like I said, there are differences from every state on Medicaid and how they decided to expand and administer their services. So we are one of the more expanded states, particularly in that disability working buy-in program, but there are these programs throughout the country in most states available. And Canary Core can help you get in contact with someone who understands the disability Medicaid programs in your state to talk through, is there an asset limit? What does it look like if you're married? Is there an income limit? Do they look at only your income or your household's income? What's the definition of work? Do you have to be on Social Security disability? And all of these kinds of questions.
Thanks, Allison. Okay, Doug, you have your hand raised. Do you want to unmute and ask your question?
There we go. Yeah, I'm Doug Tooley. I'm in Colorado as well, although the southwest corner, as opposed to the southeast and that excellent town of Fort Collins. 2024 is going to be a political year. And I would hope that we can be constructive to the very divisive dialogue that has characterized both of our political parties. That divisiveness, I believe there is a connection, perhaps more indirect than direct, but a little bit of a direct connection to the medical condition of ME. Certainly, I think it has infected the medical profession. That type of divisiveness is based on an elite sense of entitlement. And in our current society, its status is associated with playing that game. And part of that playing that game is putting other people down for whatever reason, including saying that myalgic encephalomyelitis, still working on that one, is a made-up condition. That is changing. And I would hope that we can, as a group, be part of a systemic positive change in our society. And I think this program can do that in a small fashion. I don't know if you have any thoughts. I know you're limited on what you can say politically, but I do think some political activity is allowed if you go through the bookkeeping. I don't know if there's anything at all you can say on the political context, but I'd appreciate it if you could. Thank you.
Thanks, Douglas. Appreciate your attending today. And yes, we are fighting for people with ME in all sorts of, all across this country in all sorts of political contexts. There will be, we are thinking about this, the issue of medical education about ME/CFS and making sure people, our healthcare providers, better understand and treat it, so that all people with ME get the compassionate and accurate care that they need. And there will be more information coming soon about campaign work this week, even more information about work we plan to do in the next year. Importantly, with Canary Corps, we are trying to, of course, serve the ME community, but we also won't limit the help we provide based upon, you don't need to have a diagnosis in order to get help with the Canary Corps program and get connected to these disability services and supports. And that's intentional. While we need to attack the issue of improving medical education, so critical to do, we also want to get people help right now and not have simply the limits around diagnosis and access to medically informed care to prevent necessarily access to your rights to access to supports and services as a disabled person. It is very important. So thank you for your comment. Meredith, do you want to unmute and ask your question?
Are there resources available to get like humidifiers and things like that? Humidifiers, dehumidifiers, and things like that.
That's a good question. I'm just going to jump in here, Ben. I hope that's okay. So part of the work of Canary Corps is that we're going to be, having a conversation with each participant that comes in and figure out, what are your needs? What are your prioritized needs? So if for you, that means, you really need to access a quality humidifier or dehumidifier or an air filter or whatever it is, connecting you with the right organization in your community that can help you navigate. Is there a community resource in your area that can pay for it? Is this something that could be covered under DME, durable medical equipment, under your insurance? So it could be that a care coordinator might be able to help you, or your local center for independent living. Canary Corps is ideally going to be able to put you in the right direction to access that help in your community if it's available.
I'm sorry.
You're muted.
with home help by like is there cleaning support or like lawn work, like just like cutting the grass or like shoveling? Because like it okay, honey, can you give me 1 second, please? It is a violation of code to have your lawn past a certain height, or not shoveling pathways. But those of us who are disabled are unable to do that.
Yeah, that's a great question. So Medicaid waivers are not able to help with those like outdoor type stuff, and this is something I've encountered myself. But the point of Canary Corps is to help get you to the right place in your region to connect you with help that exists. So for example, if someone came in, in the area near me, I know that there's a grant program through our county that the Center for Independent Living would refer them to for that kind of support and assistance. That's the idea of the Canary Care model, is that you can tell the person that you talk to when you come into Canary Corps, this is the kind of help that I need. They can get you to the right place in your community to get you connected with that help if it exists in your area.
Okay, thanks. And is there a way is there a way like I'm so sorry. If those services aren't in our area, would Canary Corps volunteers be able to advocate for them, and would we have guidance through you and Ben or other individuals to help get those resources in our area?
Yeah, I'll take that question, Allison. Thanks, Meredith. I appreciate you raising these issues. And so that really is one aspect of what we're trying to do with Canary Corps is, in one sense, identify what resources exist now that we can connect our community to, because this is a crisis and people need help. And so we want to really focus on what can have a tangible impact as quickly as possible for as many people as possible. And that's where a lot of Allison's presentation has focused today. We know that there are going to be plenty of areas where support won't work out perfectly. There will be gaps, there will be limitations in different states. We may connect people to resources and programs where there may be people may encounter additional barriers. And so what we will also be looking at, we won't be able to provide right away, but we will be looking at where there are patterns of gaps, of challenges, of biases in the systems, where we can then do systems advocacy. And that really links back to our ME Action Network model of wanting to build a network of state chapters all across the country, where then we can be identifying through Canary Corps the particular challenges that may exist in a particular state or region, and then provide that information to advocates who can do things like meet with local officials or program people, or even work at the federal level. So we're going to take all the information we learn going through doing the best we can to try to help people, and where there are gaps, we're going to try to improve, but also fight for changes and for improvements. And that's what the disabled activists who came before us had to do to create these programs in the first place. And we know that's what we're going to have to do to fight for our access. So I won't pretend that like everything we have a magic wand that can fix everything right away, but it does focus our vision of strategically what we want to accomplish. And that's why I would encourage people to join with ME Action, become part of our network, join the different state chapters, so that we can fight for people who are encountering all sorts of different problems and challenges in their area. Okay, so I want to go on to, we have several other hands raised and questions to get to. Let's go to Louise next. Do you want to ask your question?
Yeah, I was just wondering if y'all could offer maybe a simple process to just at the very beginning start looking into benefits. Somebody mentioned benefits.gov, and I was just on that website, and um, I went to Benefit Finder, and I just got a blank page. And then I clicked on benefits, and it just still gives me a blank page, which is kind of sad. I don't know why. But I'm just looking for, like the first 3 steps you could take, maybe just to kind of get people started.
Thanks for your question. I think it's a great one. And like Holly said in the chat, all of these questions are demonstrating exactly why we need Canary Core. So ideally what would happen once you go through the Canary Core program is that's what you're going to get, is these instructions of where do you go? How do you start? What kind of program should you be looking for? We have to be able to start the program so that we can help you and get you that individualized support, because we wouldn't be able to say make one page handout that applies for everyone across the country, for example, how to access Medicaid, because it's so different in every state. That's why we helped develop the Canary Core program, to get you exactly that information, because I know how overwhelming it is to go to benefits.gov or any of the other websites and be like, this isn't working, I don't know what applies to me. You need another human being who knows what they're doing to help guide you through that process. Canary Core is going to get you the peer support to get you to that local human being who knows how to get what the programs are and how to start and help you through it.
Thanks, Allison. So
Great.
we're coming to the end. I want to try to, we will stay on and try to answer a couple more questions. I do just want to say for people before we reach the top of the hour, we realize there's a lot to do. And so Allison and I are still working on finishing aspects of the program. The next step, we know people need, there's a lot of need for help right now. So Canary Core is still coming, and keep checking our website for more information. I encourage anyone who does have the capacity or interest to be part of making this change to come volunteer with us, join us. That can be as simple as like following a process to look up Medicaid rules in your particular state that we can then put into a national directory to be able to answer people's questions when they come from a particular area. Or there are a lot of different ways that you're going to be able to help out, and we're going to make it safe and sustainable for people who are sick and disabled to do this volunteering themselves. So please encourage you to check that out as we finish the program, and as we recruit and train the volunteers. Then we will be starting the program to offer this support. And again, if you have other feedback, questions, other things you want to make sure we're aware of and thinking of as we finish designing the program, go to that suggestion box on our website and give us any feedback. You may have had challenges, or maybe you had experiences and successes and wins in a particular way. We want to know that information, and we'll be learning. I think the big picture thing I want you to take away is that we are going to be learning with you as we go. We're going to be trying to providing you the best information up front in an energy efficient way, but also continually improving from the feedback that we get from people in both things that work and things that don't work. Okay, so I understand if those of you anyone has to sign off. Thank you so much for joining. We'll stay on a couple more minutes just to go through these additional questions. And so I want to go over to Cynthia now. Cynthia, you've got your hand raised. You want to ask your question?
Yeah, thank you very much. It was a very interesting presentation. And I have been on this journey almost as long as Allison in terms of the system. I mean, I'm 14 years. And a lot of these programs, for example, don't work where I am, which I really appreciated that you let people know the variance from even county to county is important. But also, I really appreciated mostly your list. And I think you partly answered part of my question, Ben, on what you aren't working on yet. And that's because there are huge gaps in the system, and that the housing, a lot of the areas that you said you can't work on and help with yet are often where people like me have been, kind of where I'm held up at and having trouble with the services that don't exist. So I just wanted to know a little bit of how you plan to train volunteers, because the services are so different. And I think a lot of us who've had this disease for a long time, I'm sure Allison and you can relate, you end up being looped in a continual system that doesn't exist. One place refers you to another. And so I want to make sure that volunteers understand that what may work for them or work for some people in some areas, you know, doesn't work for the people they may be working with. You know, I think some of these will be really great resources for people that are newer to the diseases. But I just wondered how you were going to handle some of that, or if you've even gotten to that point yet. Because
Thanks, Cynthia.
Yeah, good
Thank
job.
you. I appreciate your question. Thanks.
You
Yeah,
know,
we
privilege and ableism in our own community. Does that make sense? Yeah. Kind
yeah,
of.
totally. We will, if you're interested in learning more about volunteering, we couldn't fit that into today's presentation. I encourage you to come to check out our volunteer info session. And there's also FAQs that I have on our website, canarycorps.org, that answers some initial questions about how we're going to approach training volunteers. We don't expect people to have any prior experience to be able to participate in this program. And we will provide step-by-step processes. And so we're thinking carefully about how to collect the right information to point people in the right directions. You know, there will still be barriers and challenges that incur after that, but learning about those barriers too will help us to refine the program. So it's a mutual thing done together. If there are unique barriers, to report those back to us, so we can continue to think and identify new ways to try to overcome them. This is going to be a collaborative and iterative process. But Allison, did you want to say anything briefly about just the experience of kind of getting passed around from place to place, and the issue of difficulty of navigating and finding services, and how we kind of approach that?
Yeah, it's a big problem, and I think it's even more of a problem for our community because of the nature of our disease, dynamic disability, often invisible. You know, there's sort of this stigma from the places that we go for help. And my hope is that Canary Corps might help minimize some of that by sort of being this peer support cheerleader to help you get into the right office. And advocate to get what you need from that office, because I think oftentimes when they play hot potato with us. They're like, oh, this is not my problem, go over here, and then rinse, repeat, and then we don't get our needs met. If Canary Corps knows it's the job of the Center for Independent Living to make sure that you can receive care at home and not be in a nursing facility, and they're trying to push you out the door. No, they're not, because this is their job, and we will equip you with what you need to get the services there. And then, like Ben has talked about previously, that the gaps in care will help inform advocacy strategies, which I think is really important.
Thanks so much to both of you. Yeah, it was a very interesting presentation. Thank you.
Thank you. All right, Leanne, you have your hand raised. You want to ask your question?
Yeah, quick question regarding obviously you guys giving help out. I find that we all kind of need someone to talk to. We're just in a chat in a group to find like-minded individuals, maybe like a group that maybe had a moderator. What can you guys provide, or make us all aware of?
Allison, do you want to take what parts of it you want to take, and then I'll respond to the rest.
Yes, so I will refer to ME Action's got some great peer support options available already, and I want to make sure you know about them. If you don't already, Holly, I think, may put a link in the chat or is mentioning them in the chat. So if you're not part of those, please do look at them. The purpose of Canary Corps is to really be peer support to access these services, as opposed to a generalized peer support for living with ME, because those other support groups already fill that need of generalized peer space to process living with ME and get support for it. And there are moderators in those groups.
Yeah, and I'll just say, we've thought about this. We definitely, Allison and I have had many conversations about the fact there are kind of like two major components to this. One is like all the logistical challenges of just getting to the support you need, but there are also this is an emotional process. It's traumatic, it's triggering, even the different things, the small ways I've encountered different things like that. is hard, and we want to recognize that. And so part of how we're designing Canary Core is to try to get people help in an efficient way while engaging with them as real human beings in context, and that you're connecting with another person. So we're going to try to provide that aspect of it. But we also, don't want to replicate all the great support groups and communities that are out there. And we don't want to pretend like Canary Core is the only one place where people can find that help. So ME Action has a network of Facebook groups. Encourage you to check them out. And Canary Core is going to be looking and evaluating how we can also better connect with where people are finding and accessing care and support. Sometimes that may be around with an organization, sometimes that may be around a geographic area or a particular identity that you hold. Or for, you may be a caregiver and be part of a caregiving support group. So there are a lot of different places where people are receiving support. We want to be careful at Canary Core not to try to replace what already exists out there, but we're going to, ME Action does provide support. We're going to look at how we can best integrate across all the different support groups we do have, and to engage with the other places people find support too, because it's going to be important to get the word out, to reach people too. And so we want to build partnerships across the community of infection-associated chronic illnesses. All right. I think with that, we are done. Thank you all for joining. I know there are tons of additional questions people have, and we hope that as we go with Canary Core, we can answer them. Again, feel free to leave any feedback with the suggestion box to us. Anything you find could be useful and help improve. Yes.
Excuse me. Do you want to mention the date of the next Canary Core? I just saw it in the update on the website. The January 24th. January 24th.
Yeah. January 23rd, Tuesday at 4 p.m. So RSVP for that, and you'll get we'll get further updates and send you materials. That information is also, as you said, on our website at canarycore.org. You can find all that information. I've created a little widget that will show any upcoming dates will be automatically posted there. So that really is your go-to for any additional information. And we look forward to next steps. Thank you all. This is a vision that we believe is essential and important, but it's going to be one we do together. And so I'm hugely grateful to Allison helping us with Canary Core and with this presentation and the way she's been able to explain and be vulnerable to share her story. And thank you all to everyone who's come and is holding tight to this vision of supporting each other, of providing a collective response to meet our needs, because we are in a crisis where people need care, and we can do better. And that's the vision that we want to see going forward. All right, I'm going to stop the recording now, and I thank all of you for coming.